Hi everyone, welcome back to my channel, Nurse Katherine here. Over the last few months, I have been discussing different types of nursing that you can go into. It's not just bedside nursing out there. And we are going to discuss one of those options today. Today I am talking all about home healthcare nursing. I was able to team up with Fidelta Home Care for this video and discuss with their team pros of home healthcare nursing. But before we get into this video, make sure you are subscribed to my channel and hit that little notification bell so you are alerted when new videos come out like this every single week. But other than that, let's get into the 8 different pros of home healthcare nursing. In no particular order, let's start with number 1, and that would be that home healthcare nursing is low stress. And I say low stress in comparison to hospital bedside nursing. With home healthcare nursing, you may be only taking care of one patient during years, months. One patient, that's it. For example, Krista with Fidelta explained to me that their nurses take care of pediatric patients mostly. Those nurses care for one patient at a time. They can choose to take care of more than one patient, but you're only going into one household having one patient, and then maybe later in the week you want another case and you can go take on another case. But it's one patient, one nurse, not one nurse, 2 patients, one nurse, 3, one nurse, 7 patients, one nurse, one patient. Stress can be very minute in home healthcare. You are working in a comfortable setting. You are working in somebody's home. You have amenities at your hands. Krista even described it that it can be peaceful. And that does not sound like the hospital setting. Number 2 is flexibility. You get to tell your company when you are available. Say you are only available on Wednesday mornings to afternoons. Well, that company may be able to find you a case that is only for Wednesday mornings and Wednesday afternoons. In the hospital setting, you have block scheduling or maybe you have self-scheduling, but that doesn't always mean that that's the schedule you're going to have. That can always get switched up. Number 3 is variety of work, and this one can be seen as a pro or a con, but I see it as a pro. Variety of work can be vastly different or not really different at all in home healthcare nursing. Again, for example, Fidelta nurses primarily take care of trach-dependent, vent-dependent kiddos. In my eyes, I see this lack of variety of work as a pro. You become an expert in one particular field. Instead of knowing a little about a lot, kind of like in the hospital setting, you know a lot about a little. Pretty much making you an expert in that field. Number 4, we somewhat touched on already, but this is patient load. You could have one case or one patient that you are on for years. You are growing to know this family. You are growing to know that patient, whether it's a kiddo, whether it's an elderly patient. You truly can become like one member of the family. I have a friend who has home health care for her little girl, and I know she has invited those nurses to her daughter's birthday parties. That is so sweet in my eyes. So home health care nurses really can become like a member of the family. Number 5 might be a little controversial, but I don't think it is, and that is the charting. I heard a statistic recently that bedside hospital nurses spend about 30% of their day in the electronic medical record. When speaking with Krista from Fidelta, she said that their nurses spend about 30 minutes charting a day. That's wild. 30% of your 12-hour shift compared to 30 minutes. Let me say it in a different way. That 30% is about 3.6 hours compared to 30 minutes. I would also imagine with only having one patient on your caseload, you really can start charting fast over time because you know this patient so well. Number 6, we got 2 more to go after this. Number 6 is sense of autonomy. In the hospital setting, you can just feel like a puppet. You're pushing pills, you're doing this, you're doing that, you're being micromanaged. In home health, you have a ton of flexibility and a lot of autonomy in how you care for your patient. In the hospital setting, we have to tell the patients, okay, it's 9 o'clock, you have to take your meds right now. Or it is this time, it's 6:30 in the morning, you have to take your Protonics because breakfast is served at 7 o'clock. It doesn't really give the patient a sense of autonomy, nor does it give you autonomy in how to cater your care to your patient. And piggybacking off of this autonomy, your patient has a lot more autonomy at home, which can be such a gift to see and to care for a patient who has more autonomy because they're in their home setting, they feel more comfortable, and they can make more decisions on their own now. Number 7, this one I think is really cool, and I never really thought about this until speaking with Krista. This is being exposed to a wide variety of cultures and values that are different than yours. As a home health nurse, you may be visiting a patient with a totally different religious background than you, cultural background, or just beliefs in general may be totally different than yours. And that can be really cool to see and get exposed to. Maybe the family at that home cooks differently than you, and you get to be exposed to different types of cooking. Now that's what I would really want to see. I want to see all the different kinds of cooking. But beyond the point, this can be a huge pro of home health nursing. And lastly, number 8 is less germs. In the hospital setting, you are dealing with so many germs. 5 different patients, 6 different patients, 7 different patients, all with something else going on. Maybe someone has TB, maybe someone has C+, maybe somebody has MP. And hospitals can just be gross, I'll just say that. You know you're walking around on those floors where you know this room just had urine spill all over the floor, this room just had NG tube contents spill all over the floor, this one has fecal matter on it, and you're walking around in that all day long. Well, in home health, you probably won't be dealing with that too much. And it's one patient, it's not 5 different patients that's happening to. You're also not walking around the halls like you would in a hospital with 30 other different patients with their own bugs that they're carrying or reasons that they're in the hospital. So less germs sounds like a pro to me. So what do you all think? Does home healthcare nursing sound appealing to you? And if so, what kind of home healthcare nursing would you want to go into? Maybe infusion home healthcare, maybe pediatric, geriatric. Comment down below and let me know. And if you do work in home healthcare, also comment down below. I would love to hear from you, hear your thoughts and what things you liked, what you didn't like on home healthcare nursing. But other than that, that is it for today's video, everyone. Thank you for tuning in, and I will see you in the next video. Make sure you are subscribed and give this video a big thumbs up. Have a great day, everyone. See you later.